The title of this presentation is My Sacroiliac is Aligned, However the Mobility is Reduced, Part 1 of 2. My client is very active, very mobile throughout her body, but there are a couple of places in her body that are not. She had a very difficult labor, and you delivered your son when? 30 years ago? Or
2005.
2005, and you were in labor for 3 days, and you just wouldn't dilate.
Mm-hmm.
So what was the outcome of that? After the delivery, what happened? When did
I had a C-section.
You had a C-section, and then what about your back and your tailbone?
Well, I didn't feel any different.
Okay, when did your tailbone pain start?
Only a few months ago, actually. Less than a
Oh,
year
my
ago.
misunderstanding.
Yeah.
Okay, well, anyway, let's move on. So my client has excellent hip mobility, excellent foot and ankle mobility. And when I come to the pelvis, you'll see that that rises up immediately when I push on the right side. And when I push on the left side of her pelvis, that rises up immediately. Okay, I'm going to do it again, and I'm going to move it to a stop point. And then I'm going to add a little thrust. So this is an orthopedic mobility test, and she's quite stiff. Okay, now can we have you lie on your stomach? So when you sit in your car, in an airplane, you have to modify. You have to sit on a cushion.
Or on one cheek.
Or sit on one side.
Yeah.
Not good.
No.
Not good. Okay. So when you're on your stomach, just looking at you, your sacrum is rather prominent on the lower half. Okay. But we don't treat things based on how they look. Okay, I treat based on mobility. Is there a mobility deficit? Okay, well, this is her sacrum, okay, and she has prominent PSIS on each side. That's part of the hemipelvis, part of the ilium. And so if I come here, I'm at S2. If I come up one thumb width, that is S1. So that's the upper sacrum. I can load it and I can spring it. If I come to the lower sacrum, I'm not able to get any kind of movement there. And there's another test that I do, and that is to try and glide the sacrum towards your feet. And I cannot get any movement in that direction. Furthermore, your tailbone is very prominent. And so I think that this does relate to your pregnancy. And I think the baby pushed the tailbone backwards and the sacrum into what I call forward bending. Okay? Now I just want to comment on the descriptor of the sacroiliac. The sacroiliac is getting a whole lot of buzz out in the community. And so I use that in the title. And if her sacrum, in fact, doesn't forward bend and I'm able to treat that, perhaps some of that motion is restored in the sacroiliac. But it's also restored with respect to the entire pelvis, and it's also improved at the L5 segment because L5 connects to the sacrum with a disc, two facet joints, ligament, joint capsule, muscle, tendon, fascia, you name it. Okay. Now this should be L5 right here. And that is very stiff also. And then I'm going to come up to the next segment, and that's 4. And you see I can push it to a stop point, and then I can spring it. So we want to restore this normal mobility. She has pain when she sits. Can you show us with your hand where your pain is?
It's all over here.
Okay, all righty. Now, there are important ligaments here called the sacrotuberous, and these feel like bone. There is no bone right in this area, and they both feel rock hard. Then I'm going to come test sacrospinous ligaments. Those are really tight. So that supports my belief that the sacrum is abnormally tipped forward, because that would cause a pull on those ligaments. Same with the coccyx, because the sacrospinous, the lateral ligament, does connect on the tailbone and the sacrum. What effect does this have on the rest of her body? Can you put your arms on both sides of the table? Good. So what happens is that she's walking around with a pelvis that's tipped forward. So her body could follow that pattern and she could walk looking down all the time, right? However, the body reflexively compensates because the nervous system wants her eyes level. And so she tends to hyperextend in the upper back somewhere. Where? So I can test mobility here. Right here. Right here, we lack mobility. And that's probably T4. It doesn't matter what number it is. It's a thoracic segment, and this rib here doesn't move well either, and I'm sure that one doesn't as well. The other place the body compensates for that pattern is in the upper neck. Can I have you lie on your back? All right. And you've done yoga, and what else?
Yoga, Tai Chi, lots of walking, stretches of all sorts.
Yeah. So somehow that's not restoring the mobility in these structures.
No.
So it needs a very specific treatment. And the method I use is one of a very small force with the fulcrum applied for a long time. So, getting back on target, your upper neck is hyperextended like that. You may not look like it, but when I come and I come below the mastoid on the tip of the transverse tubercle of the atlas, the first neck vertebrae, I can't get any sideways movement at all. Okay? If I lift upwards on the mastoid, we get a little tiny bit of movement, and that movement is happening at where the occiput connects to the first vertebrae. If I try and traction you, there's no give whatsoever. I can't get any traction in the atlantoaxial joint. If I tip your head back, it only makes it worse. I can't get any kind of traction mobility there. If I come back to that mastoid, I can still get that little tiny bit of spring where the occiput connects to the top of the atlas, but the joint below that I don't get motion. If I put your neck in forward bending, now I can get traction and I can spring it. So all we have to do is have her walk all day long with her head pointing down to the floor. Okay? What I'm suggesting is that the tightness in your upper back, the tightness in your upper neck cannot be treated directly. It won't work because the nervous system is driving this as a compensatory pattern to the tightness in your pelvis, the tightness in your sacrum, in those ligaments, the tightness at L5. Yeah. So this tightness here, there it is right there. I'm putting a lot of force. I'm putting more than I did above, and there's no give there. And then we come up one level on the manubrium, and we have spring mobility. So this will go bye-bye. This will melt if I can improve the mobility in the sacrum, L5, pelvis, and in the tailbone. Okay? So I'm going to stop filming now, except that I want to point out the tightness in the coccyx as well. Could you line your stomach again? So this is each side of the sacrum. I'm underneath the sacral shelf called the inferior lateral angle, or the ILA. So tailbone is right here, okay? And if I try and spring it, there should be a little bit of give, but there is no give, okay? So we do want to treat that mobility. Anyway, I made a mistake in suggesting that you hurt since you delivered, since you were pregnant. But what happened a couple of months ago to cause this to hurt?
I have no idea.
Okay, no idea.
No idea.
Okay, I certainly think that the pregnancy contributed to this. We'll stop filming now. I will treat it, and then we will film the response to treatment.